Welcome to the learning module on how to read your remittance advice. A remittance advice, or RA, is a statement that contains the records of services billed to and paid from Minnesota Healthcare Programs, or MHCP, during a bi-weekly billing cycle. Provider billing and bookkeeping departments can use the RA to keep client accounts in order. Supervisors and managers can refer to the RA to ensure dates of service billed for clients match their documentation. RAs are sent to the provider's minutes mailbox and are located in the Transaction Responses folder. An RA is divided into two parts: claims data, or RA01, and supplemental data, or RA02. If you are a new Minutes user or are uncertain how to locate your RA, refer to the video using the Minutes mailbox located on the MHCP Provider Training page. We recommend that providers archive copies of their RA statements, as MHCP archives any that are more than a year old. Providers can request RA statements that are more than a year old by contacting the MHCP Provider Call Center. Let's look at a sample RA01. On the cover page is our organization's name and address, with the warrant or issue date in the upper right-hand corner. Claims data will appear in the following order in an RA01: reversals, paid primary, paid secondary, paid tertiary, and denied. The header for each section contains our provider information and the contact for the Provider Call Center. MHCP sorts the claims within each section in alphabetical order by the member's last name. Providers may request different sort options. The layout of the information in an RA01 can vary slightly depending on the provider type and claim type submitted. The first section of the RA01 contains the reversals that were made. If there were no reversals made, this section would not display. Reversals are paid claims that have been replaced or voided and can be initiated by the provider or MHCP. Let's look at the information contained in the reversal section. The first line contains the member's name, patient ID, and the payer claim control number. For information on how to read a payer claim control number, refer to DHS-3948B in the eDocs searchable document library. The next line contains the payee ID, an authorization or reference number, followed by the dates of service, procedure codes, amounts charged, adjustments, and payments. Because this is a reversal of a paid claim, there is a negative payment of $24.53 for each date of service. The total payment is a reversal of $220.77, located next to the original claim control number. The original claim control number is the number originally assigned to the paid claim before the reversal. The next section of the RA01 contains the paid primary claims. Paid primary are claims that MHCP has paid as the primary or only payer. The claim information is presented in the same way as the reversals section. Let's look at line 1 of the paid primary section for a rehabilitation service claim. The provider submitted a charge of $65 and, after adjustments, was paid $26.09. Lines 2 and 3 also show different charges, adjustments, and amounts paid. We can use the X12 External Code List site to find explanations for these codes. We locate them in the Claim Adjustment Group Codes and Claim Adjustment Reason Codes lists. Some adjustment amounts are positive numbers and some are negative numbers. Positive numbers are reductions from the provider's original charge. Negative amounts are add-on adjustments. A summary of the total provider charges, total MHCP adjustments, and total amount paid to the provider is located at the bottom of the paid primary claim. The next section contains paid secondary claims. These are claims MHCP has processed after they have been submitted to another payer, such as Medicare or other third-party health insurance. In our example, Medica is the primary payer for this claim. In this example of a rehabilitation claim, we can see submitted charges for two separate lines of rehabilitation services and the group adjustment codes. Again, the group codes and adjustment reasons can be found on the X12 External Code List site. If there was a paid tertiary claim by an additional payer, that information would be displayed on the RA01 in the same manner as the paid secondary claims section. Denied claims are found in the final section of the RA01. If there were no denials, this section would not be included. Each denial includes a remark code. In our example, the remark codes are N30 and N54. We can look up these codes on the X12 External Codes list by searching for them in the Remittance Advice Remark Codes section. If this were a denial for a pharmacy claim, we would refer to the National Council for Prescription Drug Programs, or NCPDP, site for explanations of the rejection codes. The last page of the RA01 will show the total payment amount. The RA02 will summarize everything the provider has billed during this cycle, including some year-to-date information. The reimbursement amount for number of paid claims at the top of the RA02 will match the amount paid on the last page of the RA01. Any suspended claims or claims that have attachments and have not been processed will be listed in the last section of the RA02 under Supplemental Data. In this video, you have learned what a remittance advice is, how you receive it, and the information it contains. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.